Glaucoma rarely announces itself loudly. It usually begins with subtle changes, like blurred side vision, difficulty driving at night, or a prescription that keeps changing without a clear reason, until one day the possibility of surgery enters the conversation. What many people don't realize is that waiting too long is often more dangerous than acting early, and the reality in 2026 is that glaucoma surgery has evolved significantly, becoming safer and more adaptable than most expect. Lowering eye pressure no longer has to mean fear, painful recovery, or loss of independence. Today, glaucoma treatment options range from minimally invasive approaches to powerful surgical solutions, all designed to protect vision before irreversible damage occurs. This video explains the 4 glaucoma surgeries that matter most right now, from trabeculectomy glaucoma surgery to minimally invasive glaucoma surgery, glaucoma drainage devices, and canaloplasty glaucoma. If eye drops no longer feel sufficient, if intraocular pressure surgery has been mentioned, or if understanding advanced glaucoma care feels overwhelming, this information can bring clarity. Having the right knowledge at the right time often determines whether glaucoma is managed confidently or progresses silently. What is glaucoma and why surgery may be needed? Glaucoma is not a single disease but a group of conditions that damage the optic nerve, usually due to elevated intraocular pressure over time. Because this damage often begins in peripheral vision, everything can seem normal while the disease quietly advances, which is why early detection and consistent pressure control are central to advanced glaucoma care. Treatment typically begins with eye drops or laser procedures, and for many people this works for years. Over time, however, drops may become harder to manage due to side effects, cost, or inconsistent use, and in some cases they simply stop providing adequate pressure control. When this happens, glaucoma treatment options extend beyond medication, and intraocular pressure surgery becomes a proactive step to preserve vision rather than a last resort. All glaucoma surgery 2026 approaches share the same goal: improving fluid drainage so pressure can decrease safely and predictably. Some procedures offer stronger pressure reduction with more intensive follow-up, while others focus on safety and faster recovery. Understanding this balance helps replace uncertainty with clarity and prepares the ground for choosing the right surgical option. Surgery number 1. Trabeculectomy, the traditional standard. Trabeculectomy glaucoma surgery has shaped advanced glaucoma care for decades and remains one of the most effective ways to lower eye pressure when strong and sustained control is required. It is still considered the gold standard in intraocular pressure surgery, particularly in advanced stages of the disease. The procedure creates a new drainage pathway by allowing excess fluid to exit the eye into a small reservoir where it can be absorbed, reducing pressure and relieving stress on the optic nerve. This level of pressure reduction is often necessary when glaucoma is advanced or progressing despite other glaucoma treatment options. Research consistently shows that trabeculectomy achieves deeper and longer-lasting pressure control than many newer procedures, which is why it is recommended when vision is already at risk. However, this effectiveness comes with greater responsibility, including a longer recovery period, frequent follow-up visits, and careful postoperative management to prevent scarring and complications. Trabeculectomy is best suited for cases of advanced or rapidly progressing glaucoma, or when other glaucoma surgery 2026 options have not succeeded. Compared to minimally invasive glaucoma surgery, it carries higher risks such as infection, wound leaks, or excessively low pressure, making careful patient selection and close collaboration with a specialist essential. Because of these considerations, many people naturally begin to ask whether there are alternatives that provide reliable pressure control with less surgical intensity, which leads directly to options like glaucoma drainage devices and tube shunt glaucoma surgery, explored next. Surgery number 2. Glaucoma drainage devices, tube shunts. When trabeculectomy isn't the ideal solution or fails to deliver stable results, glaucoma drainage devices, also known as tube shunt glaucoma surgery, often become the next consideration. These procedures are designed for situations where eye pressure remains high and a more predictable, structured form of control is required. Tube shunts work by placing a small tube inside the eye that directs excess fluid toward a plate beneath the conjunctiva, allowing pressure to decrease in a controlled and consistent way. Unlike trabeculectomy glaucoma surgery, which relies heavily on how the eye heals after surgery, tube shunts create a fixed drainage pathway, making them especially useful in eyes with scarring, inflammation, or prior surgical history. Devices such as the Ahmed valve, Baervelt implant, and Multino system all serve the same purpose within advanced glaucoma care by offering dependable pressure reduction when other glaucoma treatment options are less reliable. Long-term studies show that in complex or previously operated eyes, tube shunt glaucoma surgery often maintains pressure control more consistently than traditional filtration procedures. This approach is most commonly recommended for refractory glaucoma, where pressure remains elevated despite multiple treatments, or when previous surgeries have failed. While tube shunts provide strong pressure control, they require ongoing monitoring, as pressure can occasionally drop too low, making careful follow-up an essential part of intraocular pressure surgery. As Glaucoma Surgery 2026 continues to evolve, tube shunts occupy an important middle ground between older filtration techniques and newer, less invasive approaches, naturally leading into the discussion of minimally invasive glaucoma surgery. Surgery number 3, minimally invasive glaucoma surgery, MIGS. Minimally invasive glaucoma surgery, known as MIGS glaucoma procedures, reflects a shift toward balancing pressure control with safety, recovery time, and quality of life. Instead of pushing pressure as low as possible, MIGS focuses on achieving adequate control with less surgical trauma and lower long-term risk. These procedures use very small incisions and minimal tissue disruption and are often performed alongside cataract surgery. Compared to trabeculectomy glaucoma surgery or tube shunt glaucoma surgery, MIGS techniques are quicker, gentler, and associated with faster recovery, allowing many people to return to normal routines sooner. MIGS is particularly appealing when reducing dependence on daily eye drops is a priority. Devices such as the iStent Inject and Hydrus Microstent help fluid bypass resistance in the drainage system, often lowering pressure while decreasing medication use. Other MIGS approaches, such as gonioscopy-assisted transluminal trabeculotomy and excimer laser trabeculostomy, improve natural outflow without implants, reinforcing the idea that Glaucoma Surgery 2026 is about tailoring the solution to the eye rather than forcing a single approach. MIGS does have limitations, especially in advanced glaucoma care where very low pressure targets are necessary. In those cases, MIGS is often part of a broader treatment strategy rather than a replacement for more aggressive surgery. Its greatest strength lies in offering meaningful pressure reduction with fewer complications and less disruption to daily life. For individuals who need more pressure control than MIGS typically provides but want to avoid traditional filtration surgery, another option begins to stand out. Surgery number 4, canaloplasty and advanced non-penetrating techniques. Canaloplasty glaucoma and other non-penetrating techniques offer a balanced approach for eyes that don't fit neatly into traditional surgery or MIGS. These procedures focus on restoring the eye's natural drainage system rather than creating new exits or implanting devices. During canaloplasty, Schlemm's canal is gently dilated using a microcannula, and in some cases a fine suture is placed to help maintain long-term outflow. By avoiding a full-thickness opening and an external bleb, canaloplasty generally carries fewer postoperative complications compared to trabeculectomy glaucoma surgery. This option is often chosen when moderate pressure reduction is needed and safety and predictability are major concerns. While canaloplasty does not usually lower pressure as dramatically as traditional filtration surgery, studies show it provides stable and consistent outcomes over time, making it a valuable option within advanced glaucoma care. Canaloplasty fits naturally between glaucoma treatment options, offering more strength than basic MIGS procedures while remaining less invasive than tube shunt glaucoma surgery. It is not intended for cases requiring extremely low pressure targets, but for moderate disease where anatomical preservation and long-term stability matter, it often represents a thoughtful and effective compromise. This emphasis on customization reflects the direction of Glaucoma Surgery 2026, where the focus is no longer on finding a single best procedure, but on choosing the option that best aligns with the eye, the disease, and the person managing it. How to choose the right surgery for you. All of this information ultimately leads to a very practical question. How these options translate into a real decision during a real medical visit. Choosing among glaucoma treatment options is not about following trends or defaulting to the most aggressive solution, but about matching the surgery to the specific needs of the eye and the life it supports. Severity of glaucoma is usually the first factor considered. When damage is mild and pressure targets are not extremely low, MIGS glaucoma procedures often provide enough control with fewer risks and faster recovery. As glaucoma advances and vision becomes more vulnerable, options like trabeculectomy glaucoma surgery or tube shunt glaucoma surgery are often necessary to achieve the level of pressure reduction the optic nerve needs to remain stable. Overall health and risk tolerance also play a major role. When other medical conditions are present, less invasive options such as minimally invasive glaucoma surgery or canaloplasty glaucoma may offer a safer path with shorter procedures and easier healing. This approach mirrors how long-term health is managed in other areas, where consistency and sustainability often matter more than intensity. Medication burden is another key consideration. Daily eye drops can become physically and mentally exhausting over time, particularly when dexterity or memory is affected. In these situations, certain MIGS glaucoma procedures can help reduce reliance on medications, making daily routines simpler while still supporting pressure control. Previous eye surgeries cannot be overlooked. Eyes with scarring or failed prior procedures often respond better to glaucoma drainage devices, which are designed to work reliably even in complex surgical environments. In these cases, tube shunt glaucoma surgery is chosen deliberately, based on evidence and experience, rather than as a last resort. Ultimately, advanced glaucoma care works best as a partnership. A glaucoma specialist evaluates pressure trends, optic nerve health, visual field testing, and lifestyle factors to guide the choice of intraocular pressure surgery. The real objective is not just lowering numbers on a chart, but preserving vision in a way that aligns with daily life and long-term goals. Once that choice is made, the next step is understanding what outcomes look like beyond the operating room, which naturally brings research and real-world results into focus. What research tells us about outcomes? When glaucoma surgery 2026 options are discussed, what truly matters is knowing what works over time and what consistent evidence shows. Decades of clinical studies, long-term reviews, and real-world follow-ups provide clear guidance when interpreted with balance and realism. Research consistently confirms that trabeculectomy glaucoma surgery remains one of the most powerful ways to lower eye pressure, especially in advanced disease. Large analyses show it achieves deeper and more sustained reductions in intraocular pressure surgery than most alternatives, which is why it continues to play a central role in advanced glaucoma care. This effectiveness comes with a higher need for careful postoperative management and a greater risk of complications, making it most appropriate when strong pressure control is essential. Studies on minimally invasive glaucoma surgery show a different but equally valuable outcome. MIGS glaucoma procedures may not lower pressure as aggressively, but they reliably reduce medication use, shorten recovery, and carry fewer serious risks. For people managing glaucoma long-term, this balance of safety and consistency often proves more practical than maximum pressure reduction. Evidence also supports the use of glaucoma drainage devices and tube shunt glaucoma surgery in complex cases. When prior surgeries or scarring limit other glaucoma treatment options, tube shunts tend to provide stable and dependable pressure control. At the same time, canaloplasty glaucoma studies show consistent outcomes with fewer bleb-related complications, reinforcing its role as a balanced option within intraocular pressure surgery. Newer techniques such as ELT and GAT show promising early and mid-term results, particularly in preserving natural eye anatomy, though longer follow-up is still needed to fully define their role in glaucoma surgery 2026. Overall, the evidence points to a clear conclusion: there is no single best surgery for everyone. Outcomes depend on disease severity, eye anatomy, lifestyle, and expectations, and when scientific data is combined with individualized decision-making, results improve and fear gives way to informed confidence. Glaucoma rarely takes vision suddenly. It does so quietly, shaped by small decisions made over time. Understanding glaucoma surgery 2026 options is not about preparing for the worst, but about gaining clarity, control, and the ability to act before damage becomes permanent. Reflect on whether daily drops are sometimes missed, whether eye pressure has remained borderline for years, or whether surgery was mentioned but delayed because it felt overwhelming. Seeing the full range of glaucoma treatment options, from trabeculectomy glaucoma surgery to minimally invasive glaucoma surgery, glaucoma drainage devices, tube shunt glaucoma surgery, and canaloplasty glaucoma, changes how those decisions feel, because each option exists for a specific situation. The next step is using this knowledge by asking better questions, discussing intraocular pressure surgery openly, and understanding risks, recovery, and long-term expectations. This is advanced glaucoma care guided by evidence rather than fear. If this video helped bring clarity, support the channel by liking the video, sharing it with someone who may need it, and subscribing for more health content focused on protecting independence and quality of life. Turn on notifications to keep learning consistently, and continue with the next video on screen for more practical, evidence-based guidance to protect vision in the years ahead.